Good evening, everyone. My name is Ashley Marie Brown. So tonight I will be briefly discussing what a clinical nurse leader is, also CNL for short. So without further ado, let's go ahead and get started. So first and foremost, I would like to highlight the fact that the vision of the clinical nurse leader began in the year 2003 to 2004. The American Association College of Nursing, also known as AACN, and practice leaders developed the clinical nurse leader in response to demands of increased technology, complex care coordination, and growth of evidence-based practice. The clinical nurse leader is a new role in the 40 years of nursing that focuses on nursing having an advanced skill set and competencies to address the fragmentation of today's healthcare system. Now, we all know that the U.S. healthcare system is highly fragmented, and there's various issues that needs to be addressed. To name a few, medical errors, the inadequacy of patient care, so that is where a clinical nurse leader can essentially step in and tackle those issues and address those issues and manage those excessive healthcare costs that U.S. tends to have. So a clinical nurse leader is essentially a master prepared nurse generalist that can practice across any healthcare setting of their liking, with a focus on quality improvement, care coordination, evidence-based practice, and interdisciplinary communication. They essentially serve as an integral part or serve as a lateral integrator of care alongside with other healthcare professionals from various disciplines. And what distinguishes them is that the clinical nurse leader does not just focus on an individual patient. They focus on the patient population as a whole. And not only with that, they also identify patterns that may tend to hinder patient outcomes. So, for instance, there may be something that the patient may be battling and no one can seem to get to the root cause. Well, a clinical nurse leader can identify and dissect the history of patients and figure out what is ultimately contributing to um, the delay in improved patient care. So clinical nurse leader are a great asset to any healthcare organization. And you will find that they serve a great benefit to any healthcare organization.